My name is Dr. Wasif Aslam. My specialty is internal medicine. Currently, I am working as a registrar at University of Lahore Teaching Hospital Lahore, Pakistan. Today, I am presenting my recent research article, The Effect of Lifestyle Modification, that is, weight reduction, exercise, and salt restriction in lowering blood pressure of hypertensive patients. The outline of my presentation include introduction of hypertension, lifestyle modification in hypertension, objective of the study, the operational definitions, the methodology, result of the study, and conclusion. Hypertension is defined as systolic blood pressure of 140 mm of mercury or more than it, and diastolic blood pressure of 90 mm of mercury or more than it, or patient is taking any antihypertensive medications. The stages of hypertension are three. The pre-hypertensive stage, in which systolic blood pressure ranges from 120 to 139 mm of mercury, and diastolic blood pressure ranges from 80 to 89 mm of mercury. Stage 1 hypertension, systolic blood pressure ranges from 140 to 159 mm of mercury, and diastolic blood pressure ranges from 90 to 99 mm of mercury. And stage 2 hypertension, when the blood pressure reading is equal to or more than 160 by 100 mm of mercury. Hypertension is leading non-communicable disease affecting one-fourth of the world population. Its prevalence differs in different areas, like in China it ranges from 18 to 45, and in Pakistan it ranges up to 50% of the population. Complications of hypertension include cardiovascular diseases like myocardial infarction, aortic dissection, peripheral arterial diseases, and heart failure. The cerebrovascular diseases like stroke, the hypertensive encephalopathy, the hypertensive renal diseases, and retinopathy. Management of hypertension include lifestyle modification, the non-pharmacological approach, and use of drugs like ACE, ARBs, diuretics, beta blockers, calcium blockers, and GONs. The non-pharmacological measures, the recommended lifestyle modification as recommended by JNC guidelines is weight reduction, use of DASH diet, decrease sodium intake in diet, daily routine exercise, limited use of alcohol, and stop of smoking. The objective of my study is to determine the effect of lifestyle modification, that is weight reduction, exercise, salt restriction in lowering blood pressure of hypertensive patients. The operational definitions. The effect of lifestyle modification is considered positive if systolic blood pressure reading decreased by more than 20 mm of mercury and diastolic blood pressure reading decreased by more than 10 mm of mercury or both. The weight reduction positive if weight decreased by more than 10 kg in 3 months. Exercise. Patient had walked for 30 minutes at least 5 times a week for more than 3 months. Sodium reduction in diet. If patient used salt-free diet in routine for more than 3 months. The methodology. In the initial stages, I include more than 100 patients after taking proper consent, but only 39 patients fulfill my required criteria. The inclusion criteria is age ranges from 30 to 70 years, initial BMI of more than 30, and patient giving consent to participate in the study. The exclusion criteria. Those patients who fail to follow the modification advice are not included in my study. Patients with joint problem, cardiac, renal, or liver disease are also excluded from the study. The result of studies shows weight reduction, exercise, salt restriction, as explained in the patient definition, had a significant effect on lowering blood pressure and improving control in the hypertensive patients. Conclusion of my study is lifestyle modification had a significant effect in lowering blood pressure and should be advised to all the patients whether taking any hypertensive medication or not. Thank you.